Hi, Mark Jamin here, Medical Director for the Haywood County Health Department, and let's talk about this pandemic. It's been 2 weeks since stay-at-home proclamations went into effect here, and I thought it would be a good time to pause and update where we are. To date in Haywood County, there have been 3 confirmed cases, each isolated appropriately and are well. All contacts were identified with testing when necessary and are all well. These possible sources of a wider outbreak have been contained. Truth is, with the scarcity of testing though, it's hard to know what the real infection rate is. There are, however, some other encouraging signs. If there were a large group of undetected people, surely some at least would be showing up at the hospital. The hospital continues to admit a few patients with suggestive symptoms, but as of now, none have tested positive. No one with suggestive symptoms has been put on a ventilator. This is all very reassuring. We've done well. New York, for instance, had their first confirmed case on March 1st. By the beginning of April, they had 60,000 cases. That's 1 to 60,000, a doubling of roughly every 2 days. In North Carolina, that rate has been more like 6.5 days. And for us here in Haywood County, even longer. This is the effect of all the social distancing and avoiding large gatherings and good hand washing. So for each of you who have taken the recommendations to heart and acted, I want you to join me. Please put your dominant hand in the air, face your palm towards your face, and give yourself a pat on the back. Well done. It's the doubling rate that's so important right now. If you look at places with lots of cases, they are just beginning to show a plateau after installing their measures roughly 21 days ago. So we're not there yet. We've been at it 14 days, but we have another week or two to really understand where we are. This is no time to let up on our commitment, not the time to take a chance at undoing the good work we have done to date. For instance, just one infected person in Hendersonville led to over 20 others being infected in a rest home. That doubled their rate of cases in one day. You don't want to be that person. And among 60 choir members in Washington State together for a practice and trying to keep distant from one another, 45 became infected and some died. Being together in such a gathering, it can happen, and you don't want that. Now I know it's a tough time to stay apart right now. Our traditions ask us to be together. But those traditions also ask us to choose lives and life. And the way to do that right now is to keep your distance and avoid gatherings. Now, I've been honest with you all along, and I can tell you that right now, it's a little worrying about what may happen over Easter weekend. So I would ask you, keep your distance, avoid gatherings, and insist others do the same. For themselves, for you, for the rest of us. So be well, make the best of your holidays, stay emotionally connected, and physically distant.